Any myth is, I presume, wrong. So does pregnancy really affect teeth, or is it just nonsense?
Yes and no. What they're talking about when pregnancy ruins the teeth is they say that when you're pregnant, then you'll have a lot of caries or a lot of problems in the teeth that you can. I see a lot as a doctor, but it's not true, because when you have a caries, is because you have irregularities in life. You don't sleep at night, you have reflux, you eat and don't brush your teeth. You're doing a lot of things that are improper for proper oral hygiene. So this is why you have caries. So when you're pregnant and you don't brush your teeth for 9 months, it's a problem. You can't eat everything you want without brushing your teeth, without sleeping while keeping this way of life. It's wrong, and this is why you have caries. This is why you have, in many cases, inflammation. Nevertheless, there are still things that can be caused because of the pregnancy. When you're pregnant and you have inflammation, gingival inflammation that can be seen is more severe. You have some kind of small tumors that can be in the mouth because of the inflammation. Some problems that can be caused because of the pregnancy, because of all the hormones, all the problems. But tooth caries is microbial infection. It can be caused because of pregnancy. Inflammation is your body causing it. So it can be caused because of hormonal changes, for example.
I read somewhere that if you don't sleep enough at night, and something that our parents used to tell us, that if you sleep,
your teeth will fall off.
Your teeth will fall off. It is true, or is it a complete lie that parents tell their kids to shut up and go to bed?
Yeah, probably. Never heard of it.
Yeah?
Yeah. My parents didn't tell me. I like to go to sleep.
What about genetics? Does genetic affects the possibility and severity of dental problems?
Not as much as people would love to. It's like saying that I'm obese because of genetic, and nothing that I did in my life caused the obesity. For example, the amount of calories that I eat every meal. Genetics can affect teeth, but in many cases, when you have a lot of caries, a lot of problems, a lot of extractions, a lot of inflammation, in most of the cases, it's not genetics. It's because you have improper diet. It's because you don't brush your teeth. It's because you don't go to checkups. It's because your way of life is wrong. That's why when you care for your diet, when you're doing all the things right, even with problematic genetics, you can have everything fine. Everything's good. You don't must have something. But when you say my mother had problems with the teeth, that's why I have. No, your mother had problem with improper hygiene, and now you have the same problems. It's not genetics.
What about mental state? Does mental state affect the health of the teeth? Let's say if you're a more nervous person, or you live a more nervous life, you sleep less.
Yes, of course, but it affects. First of all, it can affect because you brush your teeth, you don't brush your teeth. When you have a nervous way of life, you don't have regular routine, you forget to brush your teeth, you don't eat concentrated meals 3 times a day, you eat junk food. It's a problem. And on all of that, you have white collar diseases, high blood pressure, things like this. The same, you can have a high chance for teeth grinding, for teeth clenching. You can wear off your teeth because of nerves, because of problems in your life, but you can treat it in some way. You can have a mouth guard, night guard, to have less side effects of the teeth grind, for example. Today, more and more, your job is demanding, so it's a problem. You have more and more problems like white collar diseases.
Another myth that I saw online. Only food that contain sugar affects the teeth. Food that don't contain sugar doesn't affect the teeth. Total lie?
No, it's right, but it's problematic because what you read probably is added sugar. But
Sponsored by veganlifestyle.com.
but if you eat a lot of fruits, if you eat an apple every half an hour, it's also a problem because you have a lot of sugar in the apple. You have high acid quantities, concentration. It's also, the added sugar is not a problem. Even if you don't eat anything with sweet, you can still have problem because white flour, white bread, different types of junk food, they are still problematic because it's processed food. It's much easier to get stuck between the teeth, and the microbes can transfer this food to acid. So the acid is what causes the cavities in the tooth. So it's still a problem. You can eat all the sugar you want, but eat it 3 times a day, brush your teeth, maintain a good hygiene. I'm a dentist, I'm not a dietitian. Your dietitian will probably tell you something else. But from the healthy point of view of a dentist, it's not a problem to eat a candy or 2 or 5. Just make it right.
What about this new wave that is called the Hollywood smile, the white teeth? People say it looks natural. To be honest, it doesn't look natural.
It's very white.
It's very white. Natural teeth doesn't look
Yeah,
that
but
white,
it's
right?
not. In most of the cases, it's not teeth. You can't whiten your teeth till they're very, very white. You need
Like ceramic.
Yeah, you need to add some ceramic, some composite material, or you use laminates. You glue on the teeth like partial crown, let's say.
So
that looks white.
So Hollywood continues to lie to us.
Of course.
Good marketing technique. Thank you.
You're welcome.
And thank you for being with us today. Don't forget to like, share, subscribe, follow to stay tuned with the latest cases. Thank you and have a great day.